I am delighted to be here in Oman, in this beautiful country, and I have already appreciated the great hospitality of its people. I'm here attending the course on lipid metabolism and the prevention of cardiovascular risk. And I had the privilege to give a talk about the first 1,000 days of life and the prevention of non-communicable diseases. As we all know, non-communicable diseases like diabetes or cardiovascular disease or cancer or neurodegenerative diseases are 92% of the causes of the deaths worldwide. And we should try to do something in order to prevent them. Now, what is extremely important to know today is the fact that prevention starts very, very early in life. Starts during the first 1,000 days, that is between the moment of conception and when the child is 2 years old, but even before, what we call the preconception period. This period can be a period of only a few months or maybe of a few years, but it's a very important period of life in which what the parents of the future baby and of the future adult do is extremely important, because environment is the most important factor in accounting for the rest of the health and of the wellness of our lives. The first 1,000 days of life account for about 70% of the future health. What are they? In a few words, it's the lifestyles of both parents. It's the physical activity, it's the nutrition they have, and it's also the stressors they may have and what, as an anti-stressor, they can do. So what is important would be very much for all the population to understand that when you think about a new child, what you should do is you should behave and you should follow lifestyles in a way that what's going to happen next is that the fetal programming, that is the program of the development of the fetus and then of the new child and the adult, comes out at the best, so that we can reduce the risk of diseases. I think that in a country like Oman, it would be extremely interesting to be able to do this at the preconception stage when talking to people that want to get married. I know that there is a trend here in this country for a premarital screening, and I think that it would be an excellent idea to try to link this premarital screening also with an education about the first 1,000 days of life. And I am absolutely open to any kind of collaboration. This also has the stamp, of course, of the World Health Organization, and it's recognized all over the world, and it's also within the theme of the year 2030 in order to have a better health on Earth. So we are all able to do something really good for our lives and for the future if we try to do the best we can do for the prevention of our diseases. Thank you.